I'm Jason Lally, Chief Data Officer for the City and County of San Francisco. I'm going to talk a little bit about our team and what we do. And Blake, our analytics strategist, will talk a bit more about the project where we ended up applying DBT and sort of setting up what the work was there. And then Tania, our data scientist, will wrap up with talking about the tooling and the implementation, and we brought DBT into the solution. So I'll start with who we are. So DataSF is internally, the bureaucratic name for us is the Office of the Chief Data Officer. But out in the world, we're known as DataSF. And our mission is to empower the use of San Francisco's data in decision-making and service delivery. We do that through three core areas. One is through data sharing, so improving data sharing capabilities, internal and external, so with the public as well. Data governance, so the policies, processes, standards to make sure that we treat our data as an asset and with the care that it needs. And finally, and really importantly, data use, making sure that our analysts across the city are equipped with the tools and skills that they need to make best use of the data that they have. In normal times, we do work around open data, and so you may be familiar with the Open Data Portal. This is our most public-facing product. And we also do internal consulting with departments, particularly around data science. And so Tania and our team works with departments. We all work with departments, but Tania brings her deep skill sets here to work with departments around applied data science projects. So you can read more on our showcase about some of those projects that we've done. But as things changed for everyone in February, they changed for us as well when Mayor London Breed declared a state of emergency over the coronavirus. And our best laid plans were kind of shifted and everything was reprioritized around helping with the response to the coronavirus emergency. Initially, in the very early days of the response, we prioritized standing up an internal data sharing hub around COVID-19 data and metrics. And the goal here was to get data to the people across the city that needed it, various departments and staff that needed to make decisions with that data. So we prioritized making sure that those folks had that as first responders, and then followed on pretty rapidly after that with public reporting. So this is what many of you may know of. If you haven't, you can go to datasf.org/COVID-19. You can access a variety of reports around the COVID-19 situation in San Francisco. And in there, one of the pages is around key public health indicators. These are actually the indicators that we're using to sort of judge and make decisions on reopening or not reopening. And one of those measures is around personal protective equipment. Many of us have become more expert in personal protective equipment, especially on our team, but even out in the world, as if you're paying attention to the media, you know that this is incredibly important for doctors, nurses, and hospital staff to have appropriate PPE to make sure that they can keep safe while they're attending to COVID positive and COVID suspected patients. So this metric here basically shows, what percentage of the categories do we have a 30-day supply on hand? And this is an indicator making sure that we're ready for any kind of surge. And right now we are actually in the midst of a surge. So this is just the tip of the iceberg though, that one measure. And what Blake is gonna do is talk a little bit about what's below the waterline. What did it take to bring that data together so that we can even measure these kinds of things?
Thanks, Jason. So, as Jason mentioned, with increased COVID-19, next slide. This led to a surge in demand of certain key medical supplies, in particular PPE. And so, we're just going to do a quick poll. How would you describe the gloves in the top left corner? So you can pick one. There's no wrong answer. I'm going to pick one myself. And so what made up PPE are things like gloves, coveralls, that's the top right, things that cover top to body, surgical mask, N95 mask, and a few other different items. And really these are for protection for people that are engaging with people that are suspected or likely to be COVID positive. So in the pre-COVID days, and here we see there are quite a difference, and we'll see how this plays in how people would have categorized these different degrees. And you'll see this also happened in the city. So pre-COVID, this is all really quite straightforward. On the left side, there's established suppliers that the city has contracts, particularly DPH has contracts with. On the right side, when a medical professional goes in to the supply closet, grabs a glove, grabs a mask, grabs a coverall, when it gets below a certain level, it is automatically triggers kicked off to a central DPH warehouse, and they are resupplied when the DPH warehouse gets below a certain level. The trigger is kicked off, and an order is placed with these established manufacturers to resupply them. And so it's a nice, seamless process. Post-COVID, however, these sort of established process had trouble keeping up. In particular, the suppliers weren't able to keep up, the single suppliers we had contracts with weren't able to keep up with sort of key items that normally, while they had on stock, were never needed usually at this scale, in particular things like N95 masks. In addition, it's no longer just medical professionals that need these PPE, but different people in the city workers are being called to perform functions that also now need PPE. Much in the same way, everybody needs to be wearing a mask, which counts as an item of PPE. So both the supply was constricted and the demand went up higher. So the decision was made to centralize purchasing through the city administrator's office, one to buy at scale, and this also, and next, and also to buy at scale and from different suppliers now. So we're getting items from not just these set medical companies, but also new medical suppliers are providing. And whoever has it and we can buy from, we're buying in very, very large quantities at a very rapid pace. In addition, we're getting donated items in from generous members of the public and company. If they had supplies of PPE equipment, that's all coming into the central warehouse. And the central warehouse needs to supply that out to DPH as well, because we're taking over supply purchasing for them, special COVID units that are spun up in the city, as well as 40 plus city departments. And so all this is stored, essentially this data is in, there's two different systems at play. There's one, the city administrator, and then there's the DPH warehouse. And so the system as it was had pluses and things that needed to be changed. On the plus side, it was possible to get siloed questions answered. DPH knew what they had on hand and had workable categories from their sort of years experience with these. And the citywide warehouse knew what they had on hand and had workable categories for the moment of supplying both to DPH and these wider city units. But the thing that needed some work was being able to get a citywide perspective that's highly useful for things like purchasing, at scale resupply. The sort of aggregated view of those two systems had much more friction than people were happy with. And this came down to one, there's sort of slightly different categorization schemes. And because you had these different categorization schemes, there ended up being duplication of effort, where when things were resupplied from the central warehouse to the DPH warehouse, they ended up having to recategorize things to get them into their scheme. So DataSF was brought in to try to help address that. And we were brought in, there's already talks about, oh, what we should do, we should move everything from one system into the other. And so this was right at the early days of the crisis when everything was incredibly busy. And we were like, we don't really think right now is the time to be retraining dozens of people in the sort of inventory tools that they're sort of most comfortable with. We suggested instead that we can accomplish the same thing through a little bit of governance and getting harmonized on categories and doing sort of a lift and shift method of pulling data out of both these systems, harmonizing it, and then having that central area be our source of analytics and reporting. And so to start with, it didn't really involve a technical thing, well, except for Zoom, of having meetings with the subject matter experts and stakeholders that we could get sort of aligned with on categories. So here's a much simplified example, things like exam, nitrile, medical, blue gloves. Nobody's really using blue gloves. Got harmonized to just nitrile gloves. And the different units that maybe different inventories are tracking things at, such as like a box of gloves, our pairs, are just gloves, individual gloves, was harmonized as well. This is a simplified example, things were, fairly technical, and it took a few meetings to sort of get aligned. But once we had those categorizations, then we could move to implementation. And I'll hand it over to Tania for that.
Okay, so to integrate these two data systems, essentially, we started with a quick and dirty method with the tools that we already had. So we wrote a couple of scripts in R to integrate these systems and then shared that out. Of course, this wasn't sustainable. This wasn't really production ready. So what we did as a next step is we acquired some tools to help us do this better. So we acquired Snowflake and then dbt Cloud. And then we essentially moved all of our R scripts into SQL and dbt, which was really easy to do. And now we had a production-ready environment that we could automate, that was version controlled, and we could also build in some tests for our data. So there was a lot of quality control here, and that was really, really useful. And as a result of this, we have been able to have a little less stress in a very stressful time through this data pipeline. So we have one less thing to worry about because now we have a single source of truth for the amount of PPE that the city has. So we have a citywide perspective. And this is helpful because we can identify an address purchasing needs, and we can allocate PPE resources much more smartly by building dashboards and seeing what we have. And we have a really robust data source now, which is automated, and we have reliable feeds. And as a next step, what this helps us do is it helps us apply advanced analytics on the data that we have. So now that we know how much PPE we have, how much PPE the city is using on a daily basis, we can build some forecasting models for better purchasing in the future. And that is a project that we're currently working on.
And all this is made possible by our team, but also our city partners. And I want to make sure that we acknowledge our Department of Public Health, Controller's Office, the City Administrator's Office, and then the logistics branch of the COVID Command Center, which is doing that warehousing work. This is the sort of emergency operations center for responding to coronavirus. And also, Tania mentioned that potential project and future work, maybe you. We're currently hiring an analytics engineer that is going to close on Monday, August 3rd. So a short amount of time left to apply. So if you are interested in putting in your application, please do go to datasf.org/join us. And we look forward to any reviewing future applications. I also look forward to your questions.
Amazing. Thank you so much, team. I mean, it's a happy story in otherwise stressful circumstances. So I'm glad you're able to get, some wins for the team while working through this emergency. So my co-worker Janessa actually is going to kick us off with the first question. Janessa, are you able to ask your question out loud? And just a quick reminder to other people on the call, if you have any questions, drop them in the chat, and then I'll throw it to you to ask them.
Yes, great talk. Thank you. I was curious. In the middle of a global pandemic, seems like a very stressful time to undertake any kind of like a data migration. I'm curious if you are already looking at dbt and Snowflake, and you know, or did you just go from 0 to 60, and also just how long that migration took?
Yeah, so, and feel free, Blake and Tania, to jump in here, but actually, interestingly enough, we have been actually evaluating a number of tools prior. One thing is that this essentially accelerated that work. So we had been looking at various warehousing tools, Snowflake and others, and essentially this project came in. We had already done a bunch of evaluation. We had tested, we had done some things. We hadn't actually tested dbt yet at that point, but it was on our list of things. And so what happened was this project came on our radar. We knew immediately that in order to really solve this, we needed to do it systematically. The actual time, I mean, in government time, this is a testament to the team. We moved very rapidly. To be clear, like there's still ongoing work, right? It's sort of we've set it up as an iterative and agile process. And I think that's what actually, what I love about, Snowflake and dbt, it enables sort of agile analytics. So we're moving, we were able to identify those tables, get things into Snowflake, after we had done the R scripts. It's not big data. So it's not particularly, in terms of like a migration, yeah, it is a migration of sorts, but it's not a whole lot of data. Really, the hard work was that categorization, all the things that Blake had mentioned. So that it really, I guess, Blake, it was like within a week plus that we had it up and running, like the initial like prototype and like working product.
Because both sites had already, they were looking at their own data, right? And so these are the tables that we find useful. These are the views. These are where the categories are. They were well aware of the friction points. So there wasn't a lot of, oh, let's surface. They like came with like, here's everything that's hard. These, these pain points. I was like, oh, okay. And then so it was a bit sort of pretty scoped out fairly well at the beginning. There still had to be conversations on let's get aligned at the categories, but like where we need to go, what we need to do, and people definitely being eager, right? There was, the wins were at everyone's back.
Can I ask one more question?
Sure.
I'm curious, you mentioned that you had these different stakeholders who were looking at the data in different interfaces. What were those tools that they were using to access this data?
Sure. So on the DP8 side, everything's in Oracle. So it's hard to keep track of all the different products. PeopleSoft. Like that. It's a thing. You click a button and you extract a thing, and then they extract the thing and do another thing in Excel, and they send it out. And then the next day they go back, click a button, and then they get the thing and then do that. On the central warehouse, it was just a flavor of like a SQL server, and they were connecting Power BI to that. And so we still end up using Power BI on the end for the visualization. That's sort of like one of the go-to tools in the city. But in the middle, we sort of inserted DBT and Snowflake.
So it was data analysts who basically just wanted to access the data, but they didn't want to have to learn like a new analysis tool.
Yes. Are you talking about the end users?
Yeah.
Yes. So there's different end users that sort of like, there's different scales of end users. So we also built out a sort of standard report, sort of like different stakeholders can look at, but there's also within across the city, different sort of point people for PPE that are the more analyst mindset. And they also they go directly to the source. So it wouldn't be either Snowflake or DBT because we have that internal platform, but those feed directly into that. And the platform is just serving up tabular form data that they can take and then connect to whatever's most useful for them.
Cool. I'm going to jump in with a question. So, I mean, a lot of your efforts recently have been focused on COVID, which is a completely reasonable thing to do. But I'm very aware that your organization actually works across like many different sectors of the government. So what are some of the other interesting projects that you've worked on in the past that, sort of show the breadth of the data that you get to work with in your organization?
Yeah, there's a handful of, and they're really, there's ongoing stuff. I think I'll let Blake and Tania actually speak a little bit to the data science work. I'll talk just briefly about some like larger governance things that we've been working on. So addresses are harder than you'd think. And so there's just sort of, there's been a lot of work around just making sure that addresses are consistent, standard. You kind of take for granted, like Google Maps does a lot for us, but like when you're talking about like administrative data and making sure you have accurate addresses, you do actually, it's more than just having a geocoder, right? You do actually have to have some governance. You have to actually like maintain and own those addresses, and actually Google uses those addresses. So it's like, so we take for granted that that there's actually quite a bit of work there. And then related thing that we've been doing quite a bit of work on with a lot of our partners, there's a lot of people that touch this, is around permitting. That's a very diverse set of data sets. When you say permitting, it's hard to unpack now, but essentially imagine all of the different things you need to get permission to do from the city. 17 different agencies, you permit for doing something, on the street versus, closing a block for something, right? Like, so there's all sorts of different things. It gets complex in terms of like, what do we mean by a permit? What is a project? What is a service, right? So all these sorts of definitional questions come up. So we've been doing work there. So those are two like areas, but Blake and Tania, do you want to add things about the data science work?
Yeah, sure. So we have a data science process that we do. So we work with departments in the city. So we solicit for projects. We see where people have problems that we can use data science tools, statistical tools, or modeling to help answer questions. And so we've done a couple of projects. So there's some that are on our website and some that we've worked on recently that are not quite there. So for example, we recently worked with public utilities. They were interested in increasing people signing up to green energy in the city. So they have a program where you can opt in to have some of your energy be renewable. And some people can sign in for that energy to be 100% renewable. And so they wanted to know how to target their audience, that they could segment their audience and target to reach out to more people, to get more people to sign up for this 100% energy. So that's an example of a project that we worked on where we looked at all the people who signed up in the city and did some segmentation analysis and figured out who key people are that they need to target to get more people to sign up. So that's an example of a project that we worked on. Yeah, Blake, is there anything else that you want to add?
I mean, so you can look at the showcase. So like some past projects that are on the showcase, you can read now sort of with the assessor's recorder's office. Homes are purchased. Every time a home gets purchased, it comes to the assessor recorder, get evaluated on what the fair market price is for sort of taxation purposes. So it helps sort of, build revenue for different city services like parks and things. And it was previously sort of, they have these inspectors and it's a sort of a manual process. They have to go through these different attributes, and sort of the model that we built essentially just does a first pass and sort of just fast tracks ones that are sort of clearly based on the attributes and what we see at the sales price and what we would predict the sales price would be based on these attributes like location. This is close enough and that's fine. And then the other ones get flagged for closer inspection where they have a human well-trained inspector come in and look at the different items. So it helps sort of reduce the backlog that they had.